The state of Missouri claims to have a faster, more efficient way to test for Ebola. Thank you for joining us. I'm Daniel Wynn.
And I'm Dana Clemens. Today, the Governor Jay Nixon and the Department of Health and Senior Services announced the state's public health laboratory is now a CDC-certified Ebola virus disease testing lab.
ABC 17's Lindsay Burning was in Jefferson City for the announcement this morning. Lindsay, the governor tells you our state is now safer.
Yes, the lab will now be able to do initial testing for Ebola before the CDC in Atlanta returns a confirmation of test results. So if a Missouri patient has a suspected case of the virus, this lab will let doctors know much faster if it is a true case or not. This makes Missouri one of only about 20 public health labs in the country that are able to conduct these tests. Governor Nixon says protecting public health is a key responsibility of state government.
With the outbreak of deadly Ebola virus in West Africa and isolated cases in Texas, here in Missouri we have been working methodically to ensure that we are fully prepared to protect the public in the event this disease finds its way to our state.
Governor Nixon says Missouri's public health workers, healthcare providers, and first responders have been training for potential Ebola cases. But this will help the state be even more prepared. The lab has been part of the CDC Laboratory Response Network since 1999. That network is made up of labs across the country that can respond to public health emergencies. Currently, scientists in the Jefferson City lab do more than 6.5 million tests a year. Nixon says the lab certification will expedite the process of Ebola testing in Missouri.
When it comes to detecting infectious diseases, hours, sometimes even minutes, can be crucial. And the faster we can confirm or rule out a potential case of Ebola here in Missouri, the more effectively our health providers can respond to protect the public.
Gail Vasterling, the director of the Department of Health and Senior Services, says the agency has released 10 health alerts since July to the medical community in Missouri with updates on Ebola preparedness, identification, and treatment. She says hospitals are following CDC guidelines for Ebola, including carrying personal protective equipment and the proper technique for safely removing the gear. Vasterling says the false alarm for an Ebola patient in Cole County Thursday was actually a good thing. She says it was good to see that everyone involved could work together and plan out what to do in a real case. DHSS, the Bureau of Communicable Disease, the local public health agency, law enforcement, and emergency crews worked through how to transport the patient and where to send them.
Thank you, Lindsay. The Governor Nixon says the more Ebola preparation exercises are planned, and the DHSS gave hospitals additional education yesterday at the Missouri Hospital Association statewide conference.